Before you start taking Qelbree 200 mg capsule, make sure to read the medication guide provided by your pharmacist. Take this medication with or without food as directed by your doctor, usually once daily. Swallow the capsules whole, and do not crush, chew, or cut them. If you have trouble swallowing the capsules whole, you may open the capsule and sprinkle the contents onto a spoonful of pudding or applesauce, then swallow the mixture without chewing. The dosage is based on your age, medical condition, and response to treatment. Take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition does not improve or gets worse, make sure to consult your doctor. Some common side effects of Qelbree 200 mg capsule may include drowsiness, tiredness, headache, decreased appetite, nausea, vomiting, dry mouth, or constipation. If any of these effects persist or worsen, please consult your doctor. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Qelbree may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding, rapid heartbeat, or unusual weight loss. Seek medical help right away if you notice very serious side effects like black stools or vomit that looks like coffee grounds. While rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects. If you experience any other effects, please contact your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Qelbree 200 mg capsule, extended-release selective norepinephrine inhibitors, Sel-Nari, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Make sure to discuss your medical history, including any issues with bleeding, high blood pressure, kidney or liver disease, and any personal or family history of mental or mood disorders. This medication may cause drowsiness or tiredness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or operating machinery until you know how this medication affects you. Avoiding alcoholic beverages and discussing marijuana use with your doctor is also important. If you have upcoming surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is currently unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. Older adults may be more sensitive to the side effects of this drug, especially in regards to bleeding. Always follow your doctor's recommendations on the best time to take this medication and the optimal daily dosage for your specific needs. When taking Qelbree 200 mg capsule, it's important to be aware of potential drug interactions. This medication may interact with other drugs that can cause bleeding or bruising, such as antiplatelet drugs, NSAIDs, and blood thinners. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, taking MAO inhibitors with this medication can cause a serious and possibly fatal drug interaction, so it's important to avoid taking MAO inhibitors during treatment with Qelbree. This medication can also slow down the removal of other medications from your body, affecting how they work. It's important to discuss with your doctor any other medications you are taking, such as elocitran, duloxetine, fezolinetant, and others, to ensure they are not affected by Qelbree. If you are taking low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless your doctor instructs otherwise. However, it's important to discuss this with your doctor or pharmacist for more details. Lastly, some products may contain ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist of all products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs. If you suspect someone has taken too much Qelbree and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe drowsiness. It's important not to share Qelbree with others. While taking this medication, you may need to have regular medical tests such as checking your pulse, blood pressure, and weight. It's important to keep all your medical and lab appointments and consult with your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When storing Qelbree 200 mg capsule extended-release selective norepinephrine Ru inhibitors, Sel-Nari, make sure to keep it at room temperature away from light and moisture. It's important to store it in a safe place, away from children and pets. When you no longer need the medication or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.